Hi, I'm Cordulka, and this is Detrans Diaries. Today I'm going to be talking about breast reconstruction because I am getting breast reconstruction in the next few months, and I'm going to talk about what the process was like, who does it, does insurance cover it, how much does it cost, and other similar kind of questions of that same realm. Now you may be wondering why not just wear breast forms for the rest of your life, accept your body as it is. Obviously you transitioned because you couldn't accept your body, so why repeat that process? I think it's very complicated. Well, for one, I've had a lot of time to think about this, a lot of time to go to therapy. It has been almost 7 years since my mastectomy, and I've had a lot of time to think about getting this procedure. I've also worn breast forms, not worn breast forms. I'm not really pursuing some kind of perfect cosmetic result. I would really just like to be able to look in the mirror without immediately thinking to myself, hmm, remember when you were going through all that horrible stuff and you got top surgery? Remember? Or like look at my chest and immediately think, male breast reconstruction. Male chest reconstruction. Look at you, man. Um, and well, I think I've done a lot of therapy and personal work to get to the point where I don't immediately think that about myself in the mirror. And I usually like the way I look, and I've found a way to present myself in a way that I feel is empowering. I am at a point where I would just like to no longer be there. I would expect to call a lot of offices. Finding a surgeon for me was extremely hard. There is a WordPress website called Detrans Directory that contains a list of surgeons who provide these services. In the end, I called over 10 offices and lost count. I had 5 consults for different procedures. Mostly I pursued deep flap, but I did have a consultation for fat transfer as well as for breast implants. A lot of providers who do breast reconstruction are very iffy on doing it on healthy people and will only take on active cancer cases, even for patients who are wanting the procedure done prophylactically due to having a higher risk for breast cancer. That is because, in part, it's a risky surgery, especially with the different types of free flap surgeries, and it requires both a microsurgeon and a reconstructive surgeon because there's a lot of disconnecting and reconnecting of blood vessels involved when moving the free flap. A lot of providers also push for implants because it can be easier to get insurance coverage and offers kind of a guaranteed result because they can look at it and be like, this is what size you are going to be, this is what it is going to look like. It's also a good idea to know what the surgical plan is. I did not want to see a provider who wanted to put in expanders. I was very scared that I would end up kind of stuck with the expanders, and then if something happened with the insurance, if I lost my job, I would effectively be stuck with something in my body and a place in the process. Also, it would require more appointments, more travel, more time off work, and I was also concerned about nipple migration because during top surgery, they disconnect and reconnect the nipple with the skin, and it no longer has kind of an anchor. So when the expander is put in and the skin stretches, it may not stretch equally, and things could end up wonky. Also, if your surgeon thinks they can salvage your nipple grafts, mine believes he can, but has not promised anything, and I've noticed that's the case for most surgeons are like, we will try, but I do not guarantee that you will have nipples at the end of this. I had to appeal my case also from my specific surgery location that I want to get reconstruction at. I guess I am getting reconstruction at because they initially declined me as a patient because they were like, we do not treat gender dysphoria. And I was like, I do not have gender dysphoria anymore. I am looking to have reconstruction from having had a mastectomy in 2019. And through a fair bit of conversing, emailing back and forth, talking to kind of one of the concierge people, they were able to find a surgeon at their clinic who was willing to do the procedure on me. It did take me almost 3 years from first deciding reconstructive surgery was something I wanted to pursue seriously to having a date. There were some bumps and kind of intermittent, like, I'm not really trying in the phase, but I would say I would not expect breast reconstruction to be something that is easy to get to and easy to find a surgeon to do, and all of those sorts of things. If you do decide to pursue the same procedure I've decided to get, which is DIEP flap, it is best to choose a surgeon who does the procedure extremely regularly and is very experienced and has kind of an on-site microsurgeon and does it regularly enough that they know what they're doing, because it is such a complicated procedure. And although it does not require multiple sessions like fat transfer, it can require revisions, and they are often necessary. And it's good to find a provider who is not only capable of doing corrections, but also regularly performs the procedure so that they know how to run not only the initial procedure, but the revisions through insurance in a way that they will pay for them, and is willing to do the sort of back and forth that is required with some prior authorizations, and is experienced with that process and has a team that is experienced with that process, so that you know it will get done. And I really wanted to choose a surgeon who I knew would be very motivated to work through my insurance issues if there were any. I am very lucky, and this will lead to our next topic, that my insurance did not require multiple appeals or anything of that process. What is DIEP flap? This lovely picture was drawn by Dr. Kober at Tana's Bourne, which I am probably butchering the name of, Surgical Center. But DIEP flap is named for the deep inferior epigastric perforator free flap, by which they take part of your stomach and reattach it to the chest wall, and reattach the vein in between your ribs, cartilage, all that stuff. I would highly recommend looking up more detailed videos. Why did I choose DIEP flap over other options for breast reconstruction? There is a risk for fat loss when you have fat transfer, and even the best surgeons may not necessarily be able to create an even and, I guess, reasonably sized breast. There's also a big difference between performing a cosmetic fat transfer, because there's the architecture of connective tissue and blood vessels and fat already in the breast to inject into, and doing a reconstruction on someone with a mastectomy who no longer has that, because there's just not the architecture for it. There's also evidence that it can make mammograms difficult in the long term, and especially after detransitioning, I really started to think about my long-term health with having these kinds of procedures done, and so I was very concerned with that. This leads me into the other option I did not choose, breast implants. I'm in my late 20s, and I really didn't want to have my breast implants changed out every 10 years. That would be at least 4 surgeries before I retire, assuming there was never any issue with leakage or any issue with kind of recalls or capsular contracture and all those sorts of things. And if I ever had to have them removed, I would be left with nothing. I also have MCAS, which, well, is extremely well managed, and I am extremely grateful for that fact. Puts me at a greater risk for the kind of inflammatory issues that some people experience after having breast implants. And obviously, while DIEP flap is pretty intense, once it's over and I've had kind of the surgery and any revisions, I'm kind of set for life, and that kind of long-term thinking really played into my decision. Obviously, the choice for how, when, and where you get breast reconstruction is very complex for everyone, and it's probably best made with your own research and medical professionals. How much does it cost? I went to an out-of-network provider, which, while more expensive, I was very determined to get the best possible care with people who were highly experienced, and my copay for the initial procedure ended up being a little over $3,000. It's worth noting that my out-of-pocket maximum for my insurance is $2,000, which means that there is about $1,300 that my insurance is not covering. And I would look at your own insurance benefits to figure out what that out-of-pocket maximum is, because DIEP flap is a very expensive surgery. I would expect to hit it. And if you're going out of network, well, you can appeal for in-network. I have heard it is more difficult because it is not an immediate need procedure, and I would expect that it would be very expensive if your out-of-pocket is already very high. And on top of that, I also travel, hotel, the additional person for afterwards, taking time off work, and all of that. So in terms of the prior authorization process, insurance is legally required to cover breast reconstruction after a mastectomy, as long as it was medically necessary. Although, as anyone who has worked with or called insurance companies knows, they do not like to cover things. They do not like to pay for things. I contacted my insurance company before I even had them send the prior authorization to ask for the policy for both gender-affirming care and breast reconstruction. There's a few things I would recommend looking into so that you know whether reversals of gender-related care are covered and the requirements for prophylactic breast reconstruction, regardless of the procedure you are having done, breast implants, fat transfer, all that. And if you have a history of breast cancer in your family, there is also a possibility of having it covered under that diagnosis as a prophylactic reconstruction. I also emailed my senator about the legal requirements in my state. I live in the state of Oregon, and I emailed her basically asking, is the policy for gender-affirming care make it so insurance companies now also have to cover detransition related care? I did get a lovely email back, and it reads as follows. Our office got confirmation on the language of HB 2002 does cover medically necessary gender-affirming care, which includes detransition care. They included a copy of the information from the agency and all sorts of other information. So I would highly recommend getting as much information beforehand as possible so that you are ready to advocate for yourself. I feel extremely lucky. My surgeon just submitted the prior authorization paperwork, and I got the giant envelope of all the things that had been authorized. The hospital stay, all the things. And again, I would really emphasize finding a surgeon who feels very much in your corner and will get the insurance to cover it if you do have issues. For pre-op and kind of all the what to expect before surgery, I have not had the surgery yet, but I will be filming a video after at some point to kind of update on how it went, results, that sort of thing. The process has been totally different from even top surgery. The providers have been super engaged, and I wanted to make sure I had a clear plan for travel, care, and following up with everything. I had to undergo blood testing, an EKG, a lot of different other miscellaneous tests. I'll have to get a bunch of imaging done a little bit closer to pre-op, and a psych eval for my mental readiness, and a lot more detailed medical history. They also provided a list of supplies that I would need post-operatively, and it's just been so different, so much better, kind of healing in a way, because pre-top surgery, I kind of had my consult, the surgeon signed off on it, and I kind of had to figure out post-op care besides like the creams that the surgeon's office sold to me, and it was just it's coming with much more ease than having top surgery. My prior authorization went off without a hook, so that part wasn't really a huge bump in the road. And then kind of the provider provided an expected timeline of recovery and all the paperwork for 6 weeks off work, because that is what I'm expected to have. And again, totally different. My surgeon's office made me pay for top surgery, but also made me pay to fill out the paperwork to get time off from work. And thankfully, my time off will be paid because I live in the state of Oregon and I am eligible for paid leave Oregon. And my job has approved my family medical leave, which is a United States thing. So, all very exciting. Hopefully, I will film a very lovely video explaining kind of what the post-op process was like. If you're interested in questions about kind of other preoperative planning, well, that's how I set up my apartment, meal prep, any of that sort of thing, please let me know. I'll be happy to answer questions, that sort of thing. I really struggled with finding information online about this, so I've very much flown in the dark, so I feel like there is no one else who has done this, so now I am the expert. Thank you for watching. I hope this video was informative. I hope helpful, that sort of thing.